Hello everyone, I am Dr. Teishi Borjalla, consultant doctor in Fidicus Homeopathy. Today we are going to discuss about what is menstrual cycle. Menstrual cycle is a natural cycle that occurs in every woman during each month. So this is a natural cycle in female reproductive system. In this cycle, the main changes occurs in uterus, ovaries and the brain. In brain means it releases hormones, and also on an average this cycle lasts for 28 days, but some women it may last for 21 to 35 days, but it still be normal. This cycle is mainly controlled by hormones like progesterone, estrogen and also luteinizing hormones. These hormones, some are secreted by the brain, some are secreted by the ovaries. The main primary goal of this menstrual cycle is prepare the body for pregnancy. This cycle prepares the body for pregnancy every time. When there is pregnancy occurs, it will continue to the full term of pregnancy. If pregnancy not occurs, this uterine lining may shed off. So this cycle is a continuous process from first day of one cycle to next day of one's another cycle. In this cycle, the key players are uterus, ovaries and the brain. This is about the menstrual cycle. Now coming to phases of menstrual cycle. Usually menstrual cycle consists of 4 different phases. There are menstrual phase. This phase lasts for 1 to 5 days. This follicular phase means there is growth of the follicles in the ovaries. It means growth of eggs in the ovaries. This phase lasts for 1 to 13 days. Next, ovulation. This is the most fertile phase in this menstrual cycle. Phase is day 14. 14th day of menstrual cycle we call it as ovulation time. And other phase is luteal phase. This phase lasts for 15 to 28 days. This is the 28 days of average cycle in women. Now let us explore this each phase in detail. Menstrual phase is the first phase in menstrual cycle. This cycle usually starts with a bleeding. This bleeding from first day of one cycle. It means egg in the previous cycle is not fertilized. If egg is not fertilized in that cycle, that uterine lining may shed off. This shedding of uterine lining may comes in the form of vaginal blood, that we call it as periods. In this menstrual phase usually lasts for 3 to 5 days. Some women it may last for 7 days. During this phase, hormones like estrogen, progesterone will fall down. Due to this falling hormones, it causes shedding of the uterine lining. So there is fall in the estrogen and progesterone, it will cause a shedding of uterine lining. During this period, women may commonly experience cramps, fatigue, bloating and also mood swings. These are the common symptoms experienced while in menstrual phase. This is about the menstrual phase. Now coming to follicular phase. Follicle is nothing but a type of cells present in ovaries. These follicle stays usually last for 1 to 14 days. It means this cycle overlaps the menstrual phase, but it can continue even after the stoppage of the menstrual bleeding. In this cycle, brain acts a key role. During this follicular phase, in the brain there is a gland called pituitary gland. This gland releases hormones called FSH. It means follicle stimulating hormone. Our pituitary gland releases follicle stimulating hormone. These hormones directly act on the ovaries, which causes stimulation of the follicles present in the ovaries. Due to the stimulation by the follicle stimulating hormone, follicles in the ovaries may get stimulated, but usually only one follicle may enter into mature form. So there are several follicles in the ovaries, but only one follicle mature every time. So FSH directly acts on the follicles in the ovaries. During this growth of the follicles, these ovarian follicles may release estrogen hormone. There is slight rise of estrogen gradually, and also progesterone decreases slowly. There is slight rise of estrogen hormone and also slight decrease in the follicle stimulating hormone. So in this follicular phase, the growing follicle may release estrogen. These estrogen may directly act on the uterine lining. It may develop thinning of the endometrium. It means inner lining of the uterus. It can increase the tissue deposition and also blood vessels, so it can prepare the body for possible pregnancy. If pregnancy doesn't occur, this uterine lining may shed off. So in this follicular phase, brain produces follicle stimulating hormone. This hormone directly act on the ovaries and cause maturation of the follicle. This mature growing follicle can release the estrogen hormone. These estrogen hormone directly act on the uterus to make the uterus for possible pregnancy. This is all about the follicular phase. This phase lasts for 1 to 13 days. Now coming to ovulation phase. This means 14th day. This is the dominant fertile phase of menstrual cycle. Why it is most fertile means this is the phase where highest chance of conception. We call this period as fertile window. Why we call it as fertile window means it is the period where we have highest chance of conception if intercourse possible. So this ovulation period is mainly triggered by the high levels of estrogen. In follicular phase, the growing follicles may release estrogen. So this ovulation phase, estrogen levels will be higher. Due to high estrogen levels, brain will release some hormones like luteinizing hormone. This hormone is called as this sudden rise of hormone called luteinizing surge. It means LH surge. Due to this presence of LH surge, The growing follicle, these LH may stimulate the growing follicle to burst out from the ovaries. These growing follicle, due to stimulation of LH hormone, they burst out from the follicles and enters into the fallopian tube. So it enters into the fallopian tube. Fallopian tube is the actual site for fertilization. So in this ovulation time, we can notice some small changes in our body. There is slight rise of body temperature during ovulation period, and also there is clear stitchy mucus in the cervical. By identifying these body changes and also slight rise of temperature, we can notice the fertile period. This helps in the fertility. This is all about the ovulation phase. Now coming to luteal phase. This is the last stage of menstrual cycle. In this phase, ovaries become ruptured and release egg into fallopian tube. This ruptured follicle may transform into structure called corpus luteum. This corpus luteum produces hormones called progesterone hormone. This progesterone hormone can maintain the uterine lining. Usually this growth of uterine lining will be started in the follicular phase. These uterine lining may help for the possible pregnancy. Fertilization doesn't occur, these uterine may shed off. This progesterone hormone released by the corpus luteum helps in the maintenance of uterine lining in possible pregnancy. So in this luteal phase, there is thickened endometrium. It means thickened inner lining of the uterus due to deposition of cells and tissues. In this luteal phase, it transforms into two phases. If pregnancy occurs, this uterine lining may help in the growth of the baby. If pregnancy doesn't occur, this uterine lining may shed off. This is the other possible way. The shedding of the uterine lining may lead to periods. This is all about the luteal phase. So in this luteal phase, hormone levels will be dropped. Due to falling of hormonal levels, there will be declining of the uterine lining. So due to shedding of the uterine lining, this may lead to possibility of another cycle. So menstrual cycle is a phase from first day of one cycle to first day of another cycle. This is about the menstrual cycle. If you are suffering from these hormonal imbalance, period problems and also fertility issues, Fidicus Homeopathy is here to help you. What do you get from Fidicus Homeopathy means the success of case mainly depends on three main steps. One is the treating doctor, second one is the infrastructure we are following, third one is the drug device we are using. At Fidicus Homeopathy, doctors are with passion, qualification, competence and compassion. The drug device we are following is of top quality medicines and we are also best in segment. Fidicus Homeopathy is the first homeopathy using artificial intelligence and also latest treatment in the treatment option. By using this artificial intelligence and latest technology, we can give better results to the patient. This is all about the advantage of selecting Fidicus Homeopathy. Now coming to consultation part of Fidicus Homeopathy. Fidicus Homeopathy provides two types of consultation. One is online consultation, other one is in-person consultation. In online consultation, audio and video call option available. By using these options, you can share your reports to us. If any reports are necessary, we will let you know. You can get it back locally and send it back to us. If you want to get consultation Fidicus Homeopathy by in person, you can visit our nearest branch and get consultation. This is about the consultation part of Fidicus Homeopathy. Now coming to how to consult Fidicus Homeopathy. This is our WhatsApp number 7997101303. You can call or message to us and get consultation. If you have any doubts about Fidicus Homeopathy, this is our website www.fidicus.com. By using this website also you can get consultation. Why Fidicus Homeopathy only? There are so many corporate hospitals, so many homeopathic hospitals are there. Why Fidicus only means? Because Fidicus Homeopathy stands for highest chance of health, and also Fidicus Homeopathy mainly follows three main principles. One is the highest success rate, transparent treatment and the personal care. Regarding this hormonal imbalance, period problems, infertility condition, Fidicus Homeopathy having highest success rate. And we are also providing transparent treatment. Transparent treatment means we can explain the disease condition to the patient and also prognosis to the patient so that we can maintain the transparency between the patient and the doctor. And we are also providing personal care. Personal care means we can give each and unique treatment to every patient, and also we can advise them to maintain healthy and balanced life. All these are the advantages of selecting Fidicus Homeopathy. So Fidicus Homeopathy is the best option for your safe, effective and holistic approach.
Fidicus Homeopathy.